Hi everyone. So today we are going to give you all a brief understanding about the lymphatic system. First things first, the introduction of the whole system. The three major functions of the system is first, to return excess interstitial fluid to the blood, second, absorb fats and fat-soluble vitamins, and third, defense against invading microorganisms and disease. I specifically highlighted the third function because it is not only the most widely known function of the system, but also the function that we are mainly looking at today. The components of the system include the lymph, which is the fluid that passes through the capillary walls. As the fluid accumulates, it will be picked up and removed by the lymphatic vessels and returned to the blood. The returning of the fluid is very crucial to the body because it helps to maintain normal blood volume and pressure. The lymphatic vessels are just the vessels that carries the lymph, but to note that, unlike the blood vessels, these vessels only carry fluid away from the tissues. And as for the organs, we will have a new section talking about all those organs separately later. And next, let's look at some very important terms that you should know. The leukocytes, widely known as the white blood cell, is involved in counteracting the foreign substances and disease. So it's like the fighter in our body. The several types of white blood cells are lymphocytes, granulocytes, monocytes, and macrophages. And under the category of lymphocytes, there are two cells that you should know is the B cells and the T cells. The difference between the B cells and T cells are just their structures, the genes that encode them, and the type of epitope which they bind. So it's just their functions are different. And how they get their names is the B cell is produced in the bone marrow, so it gets the B, and the T cell is mature in the thymus, so it gets the T, and it's very easy to memorize. And we are not going to look a lot into the different cells today because it's really complex and yeah. And um, the other two important cells that you should know is first the pathogen, which is a specific causative agent of disease. By causative agent, I mean bacterium or virus. And the last one is erythrocytes, which is the blood cell, and it carries oxygen in our body, and also it's the major component of our blood. So, after this brief introduction, now let's move on to another section.
Okay, these are the organs in the lymphatic system. So, the primary organs in the lymphatic system are the thymus gland and the thymus and the bone marrow. And all of the organs work together within the lymphatic and the immune system to fight off diseases. So, the thymus gland is situated in the neck and it produces T cells for the immune system. And the thymus gland shrinks as puberty approaches, and doctors and scientists are not totally sure why that happens. So the thymus is made up of two identical lobes located anatomically in the anterior superior mediastinum. And in the thymus is where T cells mature. And so within T cells, there are helper T cells, which kind of instruct other cells on what to do within the immune system, and there are killer T cells. And killer T cells carry out a cell-mediated response to invasion by foreign antigens. So bone marrow is another primary organ in the lymphatic system, and bone marrow creates T cells, and also as it creates T cells as well as the thymus gland, and it produces and matures B cells. And B cells immediately enter the bloodstream straight from the bone marrow. They don't need any more developing after they are out of the bone marrow. And B cells are the cells in the body that produce antibodies to invade viruses. Now, the T cells produced from the bone marrow, they travel from the bone marrow to the thymus for further development. Okay. So the secondary organs in the lymphatic system are the lymph nodes and the spleen. And lymph nodes are a collection of lymphoid tissue that lymph passes through before returning to the blood. And so it's kind of like almost like a filter for lymph to make sure that it is okay to go back into your bloodstream. And sometimes when you get sick or a certain type of virus is attacking your body, then your lymph nodes will swell up. And spleen is another secondary organ, and it is the largest lymphatic organ, and it is in the upper left area of your abdomen. As you can see right here, it's in the upper left of the organism's abdomen. And the spleen filters blood, and it also detects viruses and bacteria in order to trigger the release of lymphocytes. And lymphocytes are small, round, white blood cells that occur in the lymphatic system. So another organ in the lymphatic system is the tonsils. And lymphocytes and macrophages in the tonsils provide protection against harmful substances and pathogens that may enter the body through the nose or the mouth. And as you all probably know, the tonsils are located in your oral cavity, kind of near the back of your throat. And some people get their tonsils removed if they've had, like, say, strep throat a lot, because your tonsils are not doing, if you keep getting the same infection, they're not doing a good job at protecting your body against the harmful substances that may enter your body through the nose or mouth. So those are the organs involved in the lymphatic and immune system.
So I'm going to talk about the common complications with the lymphatic system, and I'm going to start with lymphedema, which is a chronic swelling of the limbs caused by the accumulation of lymph fluid. It often affects the limbs, but it also can affect the face, neck, and abdomen. It is commonly caused when you have surgeries to remove lymph nodes during cancer therapies, and those lymph nodes are mostly under the arms, are removed from breast cancer. And also, lymphedema is caused by recurrent infections, injuries, or vascular surgery. Also, there is no cure for lymphedema, but it can be managed. So another common complication is Castleman's disease. It is a rare disorder that involves an overgrowth of cells in the lymphatic system. It is caused by benign tumors that affect the lymph nodes. While it's not specifically a cancer, but it is similar to lymphoma and is often treated with chemotherapy. It can be life-threatening if it is not recognized early and if it is not treated. And it also affects the lymph nodes of the stomach and chest area. So, third common complication is Hodgkin's lymphoma. There are two types of Hodgkin's lymphoma and non-Hodgkin's lymphoma, which I'll talk about later. But for Hodgkin's lymphoma, it was formerly known as Hodgkin's disease, and it is a type of cancer that typically occurs when the white blood cells in the body become diseased or damaged, and it compromises the body's ability to fight diseases. And there are a wide variety of treatments, such as chemotherapy, radiotherapy, bone marrow transplants, and stem cell transplants. So the last common complication I'm going to talk about is non-Hodgkin's lymphoma. This is a type of lymphoma, and it's a cancer of the lymph tissue. And the tumors that develop in non-Hodgkin's lymphoma develop from lymphocytes, which are a type of white blood cell. It is more common than Hodgkin's lymphoma, and it has some of the same cures as Hodgkin's lymphoma, such as chemotherapy and radiotherapy, but another cure for non-Hodgkin's lymphoma is biological therapy. And the main difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma is the difference in the specific lymphocyte that is affected with both of the lymphomas.
Okay, I'm going to be talking about the body's response to disease, or the immune system response. There are two major categories for the body's response to threat. One is the response of the innate immune system, and the other is the response of the acquired immune system. The innate immune system response is acquired at birth, while the acquired immune system develops over time. The major players in the innate immune system are the skin, mucous membranes, and the inflammatory response system. The skin is oily and acidic, which keeps its predators out, in the digestive system on the inside, which is still considered part of the skin response system, and the stomach acid work together to kill predators. The mucous membranes work because mucus lines the inside of your nose and mouth, and it traps microbes and expels them from the body, such as in the form of runny noses. The inflammatory response system involves specialized mast cells, which search for things like unknown proteins that aren't typically in your body and release histamines when they find them, which makes the blood cells more permeable and lets fluid go through them, causing the fluid to go to one area, which causes swelling. This occurs in allergic reactions. And here's a diagram of the inflammatory response system. It shows the mast cells identifying predator cells and then the histamine cells releasing and causing swelling. There are two types of responses to disease, the specific response and the non-specific response. The specific response is a targeted response against a specific pathogen. This involves the production of specific antibodies to fight off pathogens. Only vertebrate have this. The nonspecific response is the generalized bodily response to pathogen infection. Here's more about response to disease. The acquired immune system develops since you were born. It looks out for bacteria, viruses, diseases, etc., otherwise known as antigens. There are two different types of acquired immune system response, the cell-mediated response and the humoral response. The cell-mediated response is triggered when infection enters the cells, while the humoral response occurs when the infection has only entered the bodily fluid. The cell-mediated response mainly involves T cells. Helper T cells alert other cells to attack the antigens. Again, this is when the infection has already reached the cells. The humoral response is a little bit more complicated. It involves the detection of pathogens in the body that haven't invaded cells yet. This process involves B cells, which attach to pathogens and then duplicate, creating antibodies for the pathogen, which helps provide immunity for that specific cell later on. The pathogens are marked with B cells, which tells the T cells to destroy the pathogen. There are ways that humans can respond to disease externally, such as through antibiotics, vaccinations, and antihistamines. Vaccines stimulate the production of antibodies, which helps provide immunity to a disease without making the patient sick. They are dead or inactivated diseases to prevent disease. Antibiotics inhibit the growth of or kill bacteria. Antibiotics are used to stop disease. Antihistamines stop the immune system's inflammatory response by counteracting the histamine in the body. So antibiotics and antihistamines are used when infection has already occurred, and so it's just inhibiting the continuation of that infection. And that's all for response to disease.